We're now with Maggie Wood, Executive Director of A Step Ahead. Thank you for joining us today, Maggie.
Thank you so much for having me. I'm thrilled to be here.
Now give us 3.5 minutes of your best spiel of what you would do if you won the $10,000 for your organization.
You got it. Thank you. Hi, I'm Maggie Wood, and I'm the Executive Director of A Step Ahead Foundation Tri-Cities, a local nonprofit serving the 8 counties of Northeast Tennessee. And our mission is to remove barriers to long-acting reversible contraceptives, abbreviated to LARC, because that's a mouthful, including the hormonal and copper IUDs, the hormonal implant Nexplanon, and the Depo-Provera birth control shot, and help our community prevent unintended pregnancy. We focus on LARC because it's the most effective method of reversible pregnancy prevention, over 99% effective. And these methods are the most expensive as well, making them the hardest to get. They're also pretty great too. They're the #1 birth control choice made by female doctors. One way we do this is by paying for all costs associated with getting a LARC method, including your wellness visit, pregnancy test, consultation with your provider, transportation to and from your appointments, and removal when your device is expired or you're ready to have that planned pregnancy. We do this by partnering with local clinics to offer this resource seamlessly to our community, ensuring our clients never see a bill. And if we're granted this funding, we would use it to fund these life-changing clinic resources. We also offer free comprehensive reproductive health education to our community, sharing about all types of birth control methods, which data shows is an effective way to help prevent unintended pregnancy. And if we're granted your funding, we would also use it to fund our health educator, providing this empowering education. Every dollar we spend goes toward prevention of unintended pregnancy in our community through clinic services and empowerment through education. On average in the state of Tennessee, about half of all pregnancies are reported as unintended. And on top of that, we here in Northeast Tennessee then see higher than average rates of unintended pregnancy in our teen communities, as well as on our recovery and substance use disorder communities, with rates of babies being born with neonatal abstinence syndrome, which is when a baby is born drug dependent due to exposure to opioids or recovery medication while in utero, at some of the highest in the country. The majority of women who call us are living at or below the poverty line with no health insurance. But on the whole, this resource is available to anyone and everyone of childbearing ability who wants to help prevent unintended pregnancy. This affects all of us, our friends, our neighbors, our kids' teachers, the single mom working as a CNA at JCMC, your sister who just had her third and can't possibly stomach the thought of virtual schooling another kid, maybe even some of us. And furthermore, to make it even harder, COVID has created formidable barriers to healthcare, specifically to birth control. The pandemic has disproportionately affected working mothers, and because of this, moms are leaving the workforce in record numbers, resulting in a loss of health insurance and affordable access to birth control. A recent study showed that 1 in 3 women want to delay pregnancy, and 1 in 3 women have difficulty accessing birth control method of their choice, specifically due to COVID. Here at A Step Ahead Tri-Cities, we've been able to secure an appointment for every woman who's reached out to us at a time and a place that's convenient for her. This is because we built strong relationships with clinic partners who have worked hard to ensure our clients are seen. And we've provided free health education to every community partner interested, even during COVID, thanks to Zoom. A client was kind enough to share her experiences with us. A local woman from Kingsport shared, "I never imagined I would get birth control anytime soon. It's heartwarming to know organizations like yours exist to help women like me. So for that, I'm thankful. I'll be telling anyone who's in the area who's struggling for one." These LARC resources, these extremely effective birth control resources, are readily available to so many of us due to the pure chance of where we live, the luck of our jobs providing insurance to cover them. So many of us are afforded this. Why not all of us? If they're proven to help women get a step ahead, why not all of us? This is the hope we're working to make a reality for all of us.
Thank you, Maggie. Thank you so much. I appreciate that, and good luck with A Step Ahead.
Thank you. Thank you very much for having me.
You're welcome. And thank you for joining A Closer Look and join TricityWomenWhoCare.com and vote for your favorite nonprofit today. Thank you. Welcome back to A Closer Look. If you're just joining us, I'm your host, Linda Fontaine, and we are now introducing our first nonprofit that's vying for the $10,000 prize from the 100+ Tri-Cities Women Who Care. And with me is Kimberly Brubaker Bradley, the co-founder of Appalachian Literacy Initiative. Kim, thank you for joining us, and give us your best spiel on the Appalachian Literacy Initiative and why you would love to win this $10,000.
Thank you very much. We would be thrilled to win this $10,000 and would use it to support our main program, which is that we give books to low-income school children in the Appalachian region. This is actually a super important social justice initiative, and I started it with my friend Tracy Griffith a couple of years ago when I learned that if you divide all the school children in the United States into two groups, free lunch or not free lunch, because those are the only economic ways we can track them, the kids whose parents can pay for lunch are 2.5 times more likely to read at a proficient level than the kids who get free lunch. And that seemed to me to be wrong. And it is wrong in a country as developed as the United States. I don't think your zip code or where you're born or how much your parents make should actually lead to your school success, because we know that if you read at 4th grade level by the end of 4th grade, you are 4 times more likely to graduate high school than if you can't. Reading is a fundamental ability that all of education rests upon. And it's a skill. It's something that you have to practice. And it turns out that the reason for this gap between the poor kids and the not poor kids in reading actually has to do with access to books. Poor kids on the average have 61% of low-income students don't have any books at all in their homes. On the average, they found that a middle-class kid had 13 books in their house, and for a low-income neighborhood, they had 300 kids per book. It's actually that much of a disparity. Wow. And this is something we see around the entire world. The number one thing that increases children's literacy is increasing their access to books. And we think that, here in Bristol, Tennessee, we have this lovely public library, but if you owe $10 in fines, you can't check out any more books. So when we have a kid that has lost a book, they never get to check another one out unless their parents can pay. Foster kids usually can't get their own library cards. Kids without a permanent address. We're giving books this year to a couple of kids that are living in their car. So this is actually a big thing, and we've been in existence for 3 years. Schools can apply to us that are 50% free lunch or more in the Appalachian region. We use the technical term for Appalachian, but that includes Anderson School in Bristol, Blountville, Happy Valley, Ketron, Highland View, Stonewall Jackson. We have a lot of local schools as well as some farther away. And we let kids pick the books that they want to keep, because we found that if students choose their own book, they are 5 times more likely to finish it and twice as likely to understand it as books that are just randomly given or assigned to them. We let them pick out of a big variety of age-appropriate books. We would like to expand to 3rd grade this year. There's no other program doing books for elementary school age in our area, and $10,000 would let us do that.
Thank you, Kim. We've got our time. Sorry, we're getting all 3 people in one. So thank you so much and good luck. I appreciate all the good you guys do. And thank you.
I really appreciate it. We would make every penny count.
We are now with Rachel Smith, who's the student ambassador for LEAD, which stands for Langston Education and Arts Development Incorporated. Rachel, thank you for being with us today. And tell us, what would you and your organization do if you won the big give, $10,000?
So first of all, I would just like to thank everyone for giving us this wonderful platform and this opportunity to share something that is so important to us and the rest of the community, to all of you. And so I guess I'll just jump into the big question here, right? What is Langston Education and Arts Development, or LEAD? And long story, very short, we are a 501c3 charitable organization, and we also have a partnership with the city of Johnson City, but our organization itself was founded by alumni and friends of Langston High School. And for everyone who doesn't know, Langston High School served Johnson City's Black community from the years 1893 to 1965. And this group of people kind of got together and recognized the growing diversity in this region and a need for a multicultural hub, and also a need for a space to recognize the historical significance and impact of Langston High School. And so LEAD, through an unprecedented public-private partnership, again, with the city of Johnson City, along with various fundraising efforts and grants, kind of spearheaded the successful effort to open the Langston Center on the campus of Langston High in downtown Johnson City. And so moving forward, LEAD's mission is really dedicated to providing youth and community-focused programming on, computer science, the theatrical arts, and mentoring, not only, you know, within the facility itself, but within the greater community. And in fact, we were able to begin a no-cost after-school STEM-based program that serves grades 3 through 8 in the Johnson City area through a grant from the Tennessee Department of Education. And, you know, one of our present goals is to plan and implement various additional experiential learning opportunities into this program. And furthermore, LEAD garnered funding for the Ralph E. Davis Leadership Academy, where select teens can really hone their community leadership skills to become the next generation of leaders. Because really, that's why we do what we do, to provide the tools and the resources for this next generation of young, diverse youth to become the future leaders. And so in the same spirit, we have recently launched 2 scholarships in memory of Michael Young, who was a founding member of LEAD and our chairman until his passing early last year. In fact, this year we awarded $1,000 awards to 5 deserving teens in this region. And we have also partnered with ETSU to extend another scholarship to them this year. And of course, we hope to grow and further expand these scholarships. But however, because of the pandemic, we really haven't been able to develop as many fine arts programs as we would like because of funding and lack of access to the facility because of the pandemic. And so we hope to use some of this grant to kind of hit the ground running as soon as we have full access to the center. You know, before the pandemic hit, we hosted an original in-house play, and we hope to further celebrate the arts by putting on at least 2 plays a year, along with creating a competition choir and utilizing the full on-site teaching recording studio LEAD collected funds for. But in order to achieve these things, we need ongoing support from the community through grants like this one. So we thank you deeply for your consideration.
Thank you so much, Rachel. Very well said. And good luck with everything. I wish you guys
Thank you.
good luck with all this. Thank you for joining us today.